Are brow serums aging your eye? The serums that you put on the brow to grow brow hair, do they cause the same problems that the lash serums can cause in terms of changing color of the eye, the colored part of the eye, the skin around the eye? Can they remove fat around the eye and create loss of fat and hollows, loss of fat and drooping of the eye? And can they cause ocular surface disease or dry eye, meibomian gland dysfunction? I did a complete video on the lashes. Everyone asked about the brow, and that's a natural extension of that question. I'm going to answer that for you today. A couple of housekeeping notes on the last video on lash serums that are aging the eye and that can do all of those things. The first thing I want to say, well, before we get started, I got new coffee mugs. If you remember on my Instagram, I put a post, no one wanted to order these for me from my staff. They were all so busy. We've had 4 different runs of cups before we ran out, and I got 1,000 arrived at my house the other day. So we're gonna give them away this year, and this is kind of what they look like. I'm pretty pleased. They have red inside, a nice little label here, and they have a nice shape. And yeah, I'm drinking a bit of coffee. Stay awake for these great videos. But in housekeeping, all joking aside, I want to talk about, everyone asked me about their lash serums, and it would apply to the brow serum. How do I know if it has that prostaglandin analog in it, which is bimatoprost, is what is in Latisse, which was from Allergan. And of course, the other lash serums, whether they state it or not, so it might be in there and they don't state it, it is possible, but even if they state it, a lot of times it isn't in the key ingredient list. You got to look at the full ingredient list if you want to know if your lash or brow serum has it. What you're looking for, the most common one, the bimatoprost is in Latisse. We know that. That's FDA approved. You're not going to see that one, but you will see isopropyl cloprostenate. And as all of you asked me questions, I started looking them up. And I'm not the lash police here. But I was shocked to see how they were kind of hidden. So you have to really look at your full ingredient list. And the isopropyl cloprostenate is the number 1 that I saw. There were others, and you'll see them labeled as something ATE. I can't remember offhand now, but cloprostenate is the most common. But if you see something that sounds like a prostaglandin, ATE, like bimatoprost, cloprostenate, then look it up. It might be. But I noticed you guys are on like dozens and dozens that you sent me, at least 50. And I did look them all up. It was very fascinating for me. The second thing I want to talk about was, and this goes for the brows and the lashes, I did a complete video on castor oil. Keep in mind, there's ricinoleic acid in castor oil. And ricinoleic acid is thought to hit the prostaglandin 2 receptors as well. So it does have prostaglandin agonist activity. Could it cause all the side effects? We don't know. It's just not studied. But I know a lot of people like castor oil for their brows and lashes. And on my video, a lot of people talk about how they use the castor oil, which ones they use. So go back to that video and you'll see if you want to use castor oil. But just be mindful. It does hit the prostaglandin receptor, so it could cause all those side effects. Today I'm going to tell you the 2 treatments that I do for people's brow to get their hair back. And also realize the eye is all important because the brow, what we're talking about today, frames the eye. And brow hair is in. Your youthful look is robust brow hair. It used to be all plucked away. And now it's revered to have brow hair and it's thought to be useful. So trends do change. Okay, the causes of losing brow hair. What I'm talking about today is age-related changes. There are other causes, and of course plucking, which I mentioned. When you pluck things away, it's like kind of a form of electrolysis without the energy, in the sense that you cause trauma at that all-important hair follicle. And a lot of times it doesn't grow back. And so you see people, a lot of people, I do full face treatments with fillers, with PRF gel, with all natural gels, all the things we inject into the face. I do full faces. That's what I like to do best. That's what's most rewarding for me. And so almost everyone gets their brow treated at the same time because it's part of a youthful look. And that age group is around 50 to 70 and they overpluck the brows. So what I'm trying to do, a lot of times you can't get those follicles back, but you can wake up and make the follicles that are there that aren't scarred tissued away, make them more robust and wake up some of the sleepy ones that have a little bit of hair growth but not a lot. So that's what we're doing. There are other causes, of course, vitamins, hormones, thyroid problems. A lot of women especially get their thyroid checked. It's important, not just TSH, but free T4, different measures. That's beyond what we talk about today, but understand, I'm talking about today, people who've lost their brows from natural aging, over plucking, or just want, or have no organic or other cause, such as skin conditions causing the hair growth. Now, what do we do? First of all, can the brow serums cause it? My solution is a brow serum without the prostaglandin agonist in it, just like it was for the last serum. I'll talk about that near the end, but we don't know. If you have a brow serum or you're using your Latisse that has the analog, the prostaglandin analog, bimatoprost, isopropyl cloprostenate, or others, it's about dosing and where you get it. We know it gets rid of the fat around the eye, in a percentage of patients, so theoretically it could get rid of the fat here. What am I doing to patients when I inject filler here? When I lift the brow, if they're getting PDO threads, if they're getting PRF, we're trying to make the fat, the hair follicle, more youthful. Projection, forward projection of the eye is a youthful look, and having nice confluent, meaning smooth fat, makes people look more youthful. So you don't want to get rid of the fat there. And if you apply those products with prostaglandins here, quite theoretically, it will get rid of the fat. Now, is it likely to cause ocular surface problems, dry eye, red eye? Not unless you're getting it on your lashes and in your eye particularly. Same with the discoloration of the eye. It's about dose and duration. And the most data we know of is the drops used for glaucoma. That are used in Latisse, and they were used as drops. So that dose was higher, it was placed into the eye. Same thing seems to happen when you put it on the lash line. The brow is further removed. So while I do worry about the fat pad, I don't believe that we see the eye change, the eye color change, or the periorbital, the skin around the eye color change, or the eye drooping as much if you don't use too much, and if you use it on the brow and not around. But you will get absorption, and just like you get absorption of sunscreen that goes into the bloodstream, likely you're getting absorption around the eye. My whole, I guess, advice on this for my patients, which is what I'm sharing with you guys on this channel. What do I tell my patients? Why deal with it? Why take that risk when there's other things that you can use? And I'm going to go through my top 2 today. Understand the beauty of the eye. We talked about the eyebrow framing it, the angle of the eye, the canthal tilt, the white of the eye, which we talk about a little bit, and quickly understand Lumagan is not Lumify. Many of you ask if Lumify you're using, is that a problem? That's a whitener that mainly affects the veins to whiten the eye. No, Lumagan is not Lumify. So Lumify, the eye whitener drop, should not be a problem for fat loss. Hasn't been shown to do all of those things that the prostaglandin agonists do. So that would be a third point to let you know. People did ask Lumagan versus Lumify. Lumagan can cause those because it has a prostaglandin analog in it. Lumify, I like Lumify. I'll do a complete video on Lumify if you want. So what are the top 2 things that I say to my patients to do to grow the brow, get thicker eyebrows and lashes without having to deal with the risk of all the side effects that we just talked about? Number 1 is a brow serum that I recommend, same ingredients as the lashes, that does not contain prostaglandin analogs or the product that's been associated with all those problems. Why deal with it when there's other solutions? This is overnight brow serum. This is what it looks like. I took it from our stock, and there's 3.5 mLs, and it has an applicator for the brow. So you can see it here. It looks like this. And if you were to open it up, It's a thicker applicator. Hope you guys can see that one. Okay, let's look and see why this works so well. So there are 12 hair growth factors. By the way, there's no parabens, no fragrances, and there's no pro-inflammatory products within here or ingredients within here. It contains hair-specific signaling molecules, cytokines, so signals that regulate hair growth. There's no hormones, it's prostaglandin-free. Of the growth factors for hair, they hold the hair, look here, in the anagen phase, and that's the key. That's how this works. The anagen phase is the growth phase. If we hold a hair in the growth phase, and the hair cycle of the eyelash and the eyebrow is much different than other hair. So it's very specific for these hair follicles. There is also hyaluronic acid. Of course, we know that very well. Natural humectant, native to the skin, of course, and it balances moisture. Moisture and protective barrier are key for everything skin, but also hair growth and hair follicle health. That's what we're kind of attuned to here. We're talking brow hair. So let's look at the rice bran extract. It induces the hair follicles, to be in the anagen stage, and it significantly increases the number of hair follicles to become actively growing. So it not only holds them in a growth stage, but it promotes the hair follicles to become active, because a lot of times hair is there, it's just dormant, and we're trying to wake it up. That's what we do with platelet-rich fibrin and blood products. Same thing. It's rich in oil and essential fatty acids and contains soothing enzymes, very key. And ginseng for the brows significantly elongates, again, the anagen phase. You see the common denominator for each hair cycle, and improves cell proliferation. So growth factors, no prostaglandins, and that's why I prefer it. And I've had great success with this product. In fact, it was built to help reawaken the dead follicles from overplucking. That's how this product was developed. And this can last people 2 to 4 months, I would say. A lot of times, realistically, you can use it twice a day, but a lot of people are using it really once every 2 to 3 days. Same with the lash serum, especially when you get to the lash length you want. Same as what people do with Latisse. When you get to the lash level you want, maintenance doesn't have to be every day. Number 2, almost everyone getting a full face treatment with me is going to get plasma brow. And that's a little more than you can do at home, obviously, but when I'm taking the blood, I'm spinning it down, I'm forming the gel product from heating it and injecting it back. But the serum part of that, the straight platelet-rich fibrin, you can watch my videos on plasma brow. I take the product with a micro cannula and I inject along the brow underneath, and that has had great results. And of course, the fat pad, by rejuvenating the fat pad, that gives a nice projection of the brow. And you can put PDO threads above the brow too. I'm really a big fan of that, because then you don't have to put neuromodulator or Botox type products up here. You can use a little Botox at the edge to stop with the downward fibers, and that gives you a little lift. So by getting a projection, a nice fat pad, growth with the growth factors, both topically with a product and then injecting, and then you can also put the PRF, of course, under the eye and help with under eye rejuvenation and so forth. You take it to whatever level you want. But in terms of the brow, those are 2 things. So anyone who's getting plasma brow with me is going home on this product, or you can use it as a standalone. Works very well and very successful. I put links in the more info below to the brow serum, to a video on plasma brow, and to the older video I just did a couple weeks ago on the lash serum, aging your eyes, so you can read if you want to get caught up on the complete story of the ingredients that age the eye from these serums and what to avoid. I hope that's helped. The eye is very important in beauty. I put a complete playlist up here of things you can do at home. Keep your skin and body beautiful, healthy, and vibrant.